Enrollment is now open for those who get insurance through the state's healthcare exchange. And just like those with private insurance plans, you should expect your premiums to go up. Our investigative reporter Jennifer Lewke joins us now with the real deal on just how much more you can expect to pay.
Well, and initially most insurers asked for about a 10.5% increase. Luckily, it's not going quite that high, but they did get a little bit less than that, which means if you are part of the exchange, it's open enrollment now and you may want to shop around.
Lisa Patton is a 26-year-old grad student. She's no longer able to get insurance through her parents, so she's got to decide whether to opt in to a health exchange.
I'm kind of barely making ends meet now. It's just hard to factor in the cost of an extra bill.
There are still 10.5 million uninsured Americans eligible for coverage under the Affordable Care Act, but only a quarter of them are expected to sign up this year, despite an increase in the penalty to nearly $700 if they don't.
I actually didn't know the penalty was that high.
It is, but premiums are going up too. The cost of a mid-level plan is up an average of nearly 8%. Just ask Dawn.
I've had Obamacare insurance now for 2 years, and it did go up the second year.
And it will again this year. It's a topic we've talked a lot about.
The Affordable Care Act never really addressed the root cause of rising health insurance costs.
It gave more people health care, but it didn't make it less expensive.
That's exactly it. It gave more people health care, didn't make it less expensive, other than providing subsidies to help them pay for that more expensive health care.
Pharmaceutical and hospital costs are driving rates whether you're insured through the exchange or not.
The government has become intrinsically involved in health insurance, and with that comes new regulations, new mandates, new requirements every week.
Is there anything coming down the pipeline that you see that will make it more affordable?
I think there's the potential.
But for millennials like Lisa, until that affordable care is here, it's likely the penalty is still less than the policy.
Kind of a hard situation to be in right now.
Now, more than 2 million New Yorkers have gotten coverage in the exchange since the implementation of Obamacare. The majority qualified for Medicaid, but the rest have a right to shop around during open enrollment, so you need to make sure that you do that, Ann.
And we should mention, while the rates for the exchange are going up, some people may qualify for tax credits that will help them out a little bit.
Yeah, exactly. The average tax credit in many parts of the state will actually go up a little bit as well. Like one example is in Albany County, an individual earning $30,000 a year will get an increase in their credit by about $60 a month. So you really have to shop around. You have to get the pen and paper out, see what's going to be the best deal, and then decide moving forward.
All right, pays to do the work. Thank you very much, Jen. And the state's top lawyer has settled with massive pharmaceutical